Hello and welcome to the program. I'm your host, Neil Howard. Thank you so much for joining us here on Health Professional Radio for another segment. Now, if you've been avoiding the doctor's office during this pandemic, there is a way to get a snapshot of your overall health without having to go in. Now, imagine being able to have many of the tests that you typically get during an annual physical before you even see a doctor. Well, joining us now to explain how annual physicals are being reimagined in this new year of 2022 is Dr. Jeffrey Dlott from QuestDirect. It's a testing service that empowers patients to manage and take control of their health care. Welcome to Health Professional Radio. Dr. Dlott, thank you for joining us.
Thank you for having me. Good morning.
Give us a bit of your professional background, if you would, and then let's talk about some of the most important things to take stock of when it comes to our health this new year.
Sure. I am a clinical pathologist, and I've been practicing laboratory medicine for over 20 years, and 16 of them have been with Quest Diagnostics. So I think what we should think about is how people are not getting their annual checkups because, and they're putting them off because of the pandemic. This is January 2022, and we ordinarily set, at least I do, goals to lose weight. But really, we should be thinking about what's going on inside of our bodies. And it's an annual checkup that gives us that opportunity to do that kind of evaluation and to get out in front of any potential health problems.
Now, obviously, the pandemic is one of the reasons that people aren't getting their normal, regular checkups. Is that the only problem here recently when it comes to us taking control of our health? Are there other aspects that prevent us from doing that successfully?
Yeah, ongoing concerns, you're correct, about the pandemic have kept people from going to their doctor's offices. But there are also issues related to access, convenience, and privacy as well that have kept people from going. So what we are talking about is creating a virtual preventative screening.
This screening, is it going to help us access preventative care? What will this screening help us do when it comes to taking care of our health? And what is this program called?
Yeah, great questions. So adults in America now have access to virtual preventative care screening through QuestDirect, which is the consumer-initiated testing service of Quest Diagnostics. We offer, as part of this, over 100 different health-related data, which includes your health risk assessment, your biometrics, and laboratory results. And we are calling this the comprehensive health profile. Included in this are the same tests, many of the same tests, and the biometrics that your doctor would perform at your annual visit. And so we are calling this the reimagined annual physical because of the reverse sequence. So now you are providing your history and getting the biometrics and laboratory data before conferring with your doctor. So included in this comprehensive health profile is a one-on-one visit with a clinician via virtual telehealth medicine, or alternatively, we've made it easy for you to share your results with your provider.
So I would subscribe to this program, and so would my healthcare provider? Or is this something that all the healthcare providers would already have access to and are just waiting for folks like me to subscribe to it?
Okay, great questions. This is not a subscription, actually.
Okay.
This is a consumer-initiated program. So what that means is, if I may, I'd like to describe for you how the process actually works. Yeah. Would that be okay?
Absolutely.
Okay, so start out by downloading the app. Go to the App Store and download the MyQuest app. And on the MyQuest app is where you'll have access to the comprehensive health profile. There, you'll be prompted to respond to the questionnaire, the health risk assessment, and to schedule time at one of our 2,200 patient service centers. That's where you will have your blood pressure and weight, as well as your blood drawn. Within a couple of days, you'll receive an email notification that your results are ready, and you'll be able to access them through the portal. And when you review your results, you'll find consumer-friendly messaging that's understandable. But you can also schedule then a one-on-one virtual telemedicine consult to discuss your results at no additional charge, or there's a button to forward to your doctor. So to your point, your doctor does not need to be involved in this process, but you could share your results with your doctor if you want to discuss them, him or her.
So basically, you can gauge your own progress or collaborate with your provider as you progress. So
one of the things that I did not mention, and I thank you for prompting me, is that this includes a health quotient score. So the health quotient score factors in your history, your personal history, your family history, your wellness behaviors, as well as your biometrics and laboratory data to give you a metric. And we recommend that you use that metrics to help set goals and measure your progress against those goals. And again, this is a discussion with your provider. And the beautiful thing about this, and what we're really excited about, is by getting the report and getting your data ahead of time, it gives you time to reflect on it so that when you do engage with your doctor, you can have a more meaningful and substantive discussion.
Does the initial evaluation determine how likely a person is or is not going to be, compliant with medications, exercise, or dietary regimens that are suggested?
The evaluation is intended to be a screening evaluation. So it will screen for risks for diabetes, for heart disease, for anemia. We also offer gender-specific profiles, too, where you could optionally choose a PSA for men for screening for prostate health, or TSH for women to screen for thyroid health.
Is this something that is going to be covered under a patient's insurance?
That's a really good question. So again, this is consumer-initiated testing, which means that it is direct pay. It is not billed to one's insurance. However, one can go to their FSA or HSA for reimbursement, and that is typically reimbursed under those programs.
Right. Well, doctor, if you would, give us a website where we can learn more.
Thank you so much for asking. Please visit QuestHealthScore.com for more information about the comprehensive health profile.
It's been a pleasure speaking with you. Thank you so much for giving us this information, and hopefully you'll return.
Thank you so much for having me. Have a great day.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jeffrey Dlott. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.